Well, doctors and dentists from across the islands are urging lawmakers to get rid of the general excise tax on health care.
Our Kristen Concilio spoke today with some of them who flew in from the neighbor islands and say they're being taxed out of business.
Looks pretty good, buddy.
Dr. Jason Ching pays about $70,000 a year in general excise taxes to care for underserved patients on government health plans that many other doctors won't take.
It's just another contributing factor that on the financial side, just can't stay in business, to be honest.
Ching runs Oahu Pediatric Dentistry, a dental practice established by his father 50 years ago. On top of the rising cost of medicine, providers say the general excise tax is killing their businesses and making it harder for patients to get care. Doctors currently aren't allowed to charge GE taxes to patients on government insurance plans.
It's crisis levels right now in Maui. In the last 6 months, we've had half a dozen anesthesiologists quit and go to the mainland. We've had one of our 2 neurosurgeons also leave, and we are losing an OB-GYN as well. And before COVID, before the Maui fires, we already had the highest shortage of doctors, over 43% in all of the islands.
That's why they want lawmakers to eliminate the GE tax on medical and dental services for patients with Medicaid, Medicare, and TRICARE. Doctors say they're struggling to stay afloat because the reimbursements for those patients are already low.
Allowing us to serve our patients with Medicare, Medicaid, and our veterans and exempting them from this tax will actually help save a lot of the private practices that are now dwindling in numbers and approaching zero, actually, if not a lot of these systemic issues change.
According to the University of Hawaii, the state is short almost 800 physicians. The crisis is especially bad on the neighbor islands.
Patients are not able to find care. Our veterans and our Medicare, Medicaid patients already have a low number of practitioners they can go to, and the ones that do serve them are taxed, are penalized with this tax. And so that drives a lot of these physicians to out of business.
This is the 5th year that doctors and dentists have been lobbying lawmakers to change the tax before more providers leave the state. Kristen Concilio, Island News.
The deadline is about 2 months away for healthcare professionals to apply for loan debt repayment. The state's healthcare education loan repayment program helps those licensed or certified to provide care for patients here in Hawaii. It's funded to provide $30 million to those who accept public insurance for at least 30% of their patient care claims. We posted a link to apply to our website, kitv.com. The deadline is July 1st.